Good evening, everyone. I'm Gary Christenson, Mayor Malden, and you're back here with us this evening for another update on COVID-19. Can't believe we're almost closing in on a year that we've been together, and we're going to keep going until we get to where we all want to go. And thankfully, there are many people that want to make that happen, including tonight's guests. We have Chris Webb, the director of our health department here. We're also joined by Kourtney Nickerson, the chairperson of our Board of Health. And we also have Christian Lanphere, who has been with us many times from Cambridge Health Alliance. This would not be possible without Ron Cochran, our Director of Communications. And we also want to say thank you, as we always do, to Malden Access, no longer Malden Access Television, Urban Media Arts, otherwise known as UMA. So they just rebranded this week, and we want to congratulate them on all their efforts. So what we'd like to do is just, as always, get a couple of introductory statements from our panelists. They'll also provide you with their contact information in case there is a question that you didn't ask tonight or you thought of after the show ends. We believe that will go to about 8 o'clock this evening. The other thing is you can call in at 781-388-9394. So without further ado, let's introduce our panelists this evening. So let's start with Mr. Webb.
Good evening, everyone. It's always great to be back on the show because we do get so much more feedback from it. I want to thank you for that. Today's numbers are as grim as we could imagine, but not excessively so. We have 5,182 positive cases right now, and we've suffered 105 deaths. It's unfortunate, and I hate to make light of it, but we're doing pretty good. I don't know. I like to think it's the people taking the message and holding on to it. Our neighbors are, just ravaged by this, and these are not light numbers, but at the same time, you can see that we're working hard towards maintaining mask use. The restaurants and other venues that are open right now are doing a very good job. We had a little bumps here and there, but again, that was always about education and understanding the guidelines. So I like where we're at, and vaccinations are right around the corner.
All right, Chris, if someone wants to get a hold of you, how do they do it?
You can call me at the office at 781-397-7049. My email is cwebb, W-E-B-B, at cityofmalden.org.
All right, to my far right, Kourtney Nickerson. Good evening.
Good evening. Thanks for the invitation to be back tonight. I'm Kourtney. I serve on the Board of Health for the City of Malden. I am a research scientist with a background in infectious disease, so my goal is always to help everybody just understand some of the information that's out there, maybe put it into a community perspective as well. You can reach me through Chris. Feel free to just email him, and he'll pass messages along to me. So thank you.
All right, Mr. Lanphere, welcome.
Good evening. Thanks, Mr. Mayor, and welcome. I just want to thank all the residents of Malden for allowing me the opportunity to join all of you. So what I would say for us now is similar to what Chris has been talking about. We've actually had a better week in Massachusetts around hospitalization. So this is the first week that the hospitalization rate has started to trend downward, which is good, although I would say that the numbers still remain quite high, but there is some hope if we continue in this direction that hospital capacity across the state, particularly in our region of the state, is starting to open up just a little bit. We're cautious with those numbers, but we are seeing a trend that has been going in that direction for the last 7 days. And so we're hopeful. I can be at the Cambridge Health Alliance at 617-665-1000.
All right, very good. So let's go with a couple of questions to warm you all up. Let's stay with you, Mr. Lanphere. Do the new variants of COVID-19 diminish the potency of vaccines or overcome natural immunity?
So what we've learned so far, both from studies have both come out from Moderna and Pfizer is that they're confident that the variant is currently covered in the vaccine. We also know, based on when this was initially introduced in England, and the studies that came along with that, that the variant is no more dangerous, but it is much more contagious. So there is worry with the one case in Boston, the young girl who traveled from Great Britain, and her coming to Massachusetts, sort of what that will mean. I know that they've done contact tracing with 85 of contacts that were around her. So my hope is that it's being contained a little bit, although there are other surrounding states that have also seen the variant. So my guess is that we might be seeing more of this in the next couple of months.
Mr. Lanphere, how many more variants could we see?
Well, it's a virus, so I think there could be more. I mean, I'll certainly leave that to Kourtney from an infectious disease standpoint. My concern, though, with the variant is that the hospital capacity at this point, which is the numbers I trend to sort of see, how much trouble we are in. The system is quite full, and my concern is that if we don't really get control of this, and if people don't continue to do the work that our public health professionals are advising, my fear is that the medical and health system that's already being quite taxed will be quite overloaded sooner than I think. We're trying as fast as we can to get this vaccine into people's arms, but we do need to stay the course until we can get enough people vaccinated to start getting some immunity.
Okay, Dr. Nickerson, so how many more variants are there and how quickly could they develop?
So our surveillance program to actually monitor how the virus is changing has lagged a little bit behind the rest of the globe, but I've heard there are more efforts now for us to monitor how the virus is adapting to the different pressures that we put on it. So it's not unexpected that we would see sort of variation and changes and variants pop up, especially as we do things to sort of slow the spread. And that's always been the goal, is to stop it from being able to spread. So it's not surprising that you see a variant pop up that is more easily spread because it's taking advantage of a loophole that it found. So from that perspective, it means that what we're doing is working. It just means that the virus is smart too. And we've got a light at the end of the tunnel. The vaccines are here. We just need to work towards distribution. And this is probably the worst of it for everybody because we're coming up on a year. These guidelines are hard. And, knowing that masks aren't going to go away once people get vaccinated, that's going to take a little bit of time. It's a lot of information to process. So I understand where people are coming from, that this is pretty stressful. But variants make the news because it's interesting information. We're all learning about this at the same time. And understanding what it means functionally, how it's going to stress the hospitals, if it is going to stress the hospitals, and we need to continue doing our part to stay healthy and protect our community.
All right, over to Mr. Webb. Question we get frequently these days, now that we're almost a year in, someone gets COVID-19, is reinfection possible?
Well, the science says it is possible, but it's on a scale that's infinitesimal. Not many people get it. I think a lot of it too may be that the ones that do get it again are getting another variant. And luckily, they're getting to the hospital, or they're already in hospital when it happens, and they're able to shut it down. So there's a couple of ways that study will probably go.
Okay, and let me stay with you, Mr. Webb. One recent study that I was looking at said that the future of COVID-19 will be that it will be no more of a common threat than the common cold. Do you agree with that?
I do. If the vaccine proves to be everything that we hope it to be, like a typical influenza vaccine, and I'm confident that's what will happen, that it will be just like that. You might get a booster shot every once in a while, or it may be a heavy COVID year. There'll be ways of telling. So people will take a COVID year very seriously. I think so. Vaccinations will be up if that's what's going to be required. Sure.
Okay. Dr. Nickerson, recently we were talking about the news. Now there's been a couple stories about 2 face coverings. Are they better than 1?
That's an interesting question. I know that there's been some discussion about the type of material that you use in a face covering, because the goal is to catch or slow down anything that you respire. So any particulates that come out and catch, you want that to catch in that matrix of the face covering that you're actually wearing. So there's different, we've heard about different materials. You've got your N95, you've got cloth, there's been some studies that compare what's the effect of a gaiter that people wear and they pull up over their face versus some other things. So there is an association between the material and the efficacy. I don't know so much about 2 layers versus 1. It would probably depend on the type of material. And I think the CDC might have some good guidance on exactly what types of materials are more effective than others. So I would advise people to look into some of those resources. And I can see if I can pull those up later too, and we can maybe share those on some of the different channels if possible.
Christian, I think you've seen prior pictures of me getting the flu shot. And so there are many of us who want to avoid shots at all costs. So do you need the vaccine if you've already been exposed?
So
Yes.
yes.
Oh, I'm sorry, Chris.
You absolutely need the vaccine. I mean, the vaccine, and you need both. You need right now between Moderna and Pfizer, you need both doses. I do think that it is inappropriate for people, unless they've had a severe anaphylactic reaction to the vaccine, to only get 1 shot. You need both for maximum protection. So we are asking people, and we've done about almost 5,000 shots since the middle of December. And we've had, on average, I think we've probably had maybe 12 people out of 5,000 people who have already received the vaccine who had maybe a headache or had some flu-like symptoms on the 2nd shot, it's a very small number. Most people who we have vaccinated directly, the only common complaint was they had a sore arm the next day. People were relieved. People were glad they got it. But it's also good, just being a good citizen, you need both doses to make for maximum protection. We've gone away a little bit. I'll certainly trust my public health colleagues. We have asked people, particularly who have had COVID in the last 90 days, to wait to be vaccinated for the sole purpose that they already have the antibodies. And so this just allows an opportunity for more people to get the vaccine and to create more immunity in the community.
All right, I think Mr. Webb's emphatic yes was geared toward me. So, Chris, there is no way out. Everybody should get this shot.
Yes.
Do not be fooled, right? Do not be fooled.
Well, the main reason is the variant, right? If you got through this and another variant the year after next, just like every year with flu, there's different strains of flu. You're going to have a different strain of the virus. And this vaccination should protect you, if not from a majority of those offshoots.
Okay. All right, let's go up top to Mr. Cochran. I'll save a few of these other questions for later.
What do we have? Actually, can I jump in? I want to amend my comment from before. I just pulled up the CDC guidance, and they do not recommend masks with a single layer. In fact, they recommend masks with 2 or 3 layers. They have a really nice chart that talks about the different types of masks and what is recommended for people to wear that will be more effective. So
what's that address, Doctor?
So, you know what? I'll send it to Ron and see if he can share it, because it's a little bit long.
All right, very good. All right, Mr. Cochran, over to you.
Okay, so as we like to always do, we like to remind folks on how they can get in touch with us, a number of ways possible. And I'll be monitoring all these channels. First of all, you can call in the old-fashioned way, and that's by dialing into the Malden Access, the UMA studios. I'm probably going to do that all night tonight, so forgive me up front, you guys in the studio. That number is 781-388-9394. And for those of you that are online, you can watch this broadcast either through the YouTube channel for UMA, as well as Comcast Channel 22, Verizon Channel 26. We're looking for questions on our own Facebook page, either right in the thread that we just recently posted about the show or in Messenger. And then we'll also poke over to the YouTube live stream at UMA and see if there's any questions in there. So we'll kick it off right away with our first question. I think it bears probably most on everyone's mind, and that is, what is the vaccine schedule for the city of Malden?
Okay, Mr. Webb.
Well, it's taken a little while to formulate, and the main reason being vaccine supply. So now we've got a pretty good idea what the vaccine supply can be. We're hoping that with the new administration coming in, it will improve that much more. So what we came up with is we have some clinics that we have to do right now, which are we'll be having on the 26th. It's a closed clinic, so those people have been invited from health home care agencies, congregate living facilities, and places like that. We'll get everybody through and vaccinated. Then we'll finish the rest of phase 1, which are home health care people and people, dentist offices, ophthalmologists, chiropractors offices. They can come in over the next 2 clinics, which will be on the 28th and the Tuesday, February 2nd. And that will close out phase 1. We'll start phase 2, which is school teachers and all the essential workers. That will start February 4th on that Thursday. And we'll follow into a Tuesday, every Thursday schedule, every first Saturday, every third Saturday. The hours I'll go through the hours, but they might change a little bit before we finalize them based on how volunteers can get to the clinic and what times. So we're kind of getting a little flexible there, but we'll have a good schedule probably by hopefully Friday that we can post.
Okay, and Mr. Webb, what about our seniors?
The seniors will be starting it on February 4th. That's only because we should have enough vaccine to get people in and going. The rules have changed. We had a 48-hour wait period for vaccine before. Now we have to order a week in advance, and we could lose half our order. We could lose our whole order. So we have to caution people that until it's a true and guaranteed pipeline, there could be disruptions and clinics could be canceled because the vaccine wasn't available. So, but there'll be diversion sites. We're going to work on that as well. There'll be diversion sites to the mass sites up the street in Topsfield, Fenway, train ride away, whatever you're comfortable with.
Okay.
So we'll make sure those are well booked, that our clinic is down and they should expect our traffic.
And Mr. Webb, it should be noted that, let's say, for instance, February 4th, you start with seniors. That's the first shot. When would they get the second shot again, roughly?
They'd get a notice through their email. Those that we register ourselves, we'll keep a list of those folks, and we'll mail them a invitation, which is basically what it is, to come to a clinic on their 28th, 29th, 30th, 31st day, whatever falls on a good pattern, and come on in and get your second dose.
Okay, very good.
Same method they'll use for the first dose. They'll get an invite to register.
And then we should let the public know that on Friday you plan to do a written and potentially a video update on what you just described for the city. Okay.
We're going to try to get a little video shot of the registration form so people can get a sense of what they're looking at.
All right, very good. Back to you, Mr. Cochran.
We're going to follow up on that and say that this is a common question that we get whenever we offer things by computer self-service. What about folks that don't have access to the internet, or maybe they're not comfortable filling out a form online? What should those folks do?
Chris?
Well, a great question, actually. we are working on we have a meeting Monday with all the partners that we usually use, the senior center, the teen center, the medical reserve corps, the community emergency response team. And I'm going to put it to them. How can we work together to get a volunteer? We have good, strong volunteers within those groups already. We need some folks to spell health department employees so that we can register more people and check them in and check them out. So we're going to put in a 311 call center kind of setup. We'll probably have a different name for it. And you'll be able to call in. And if you can't register yourself, you say, I need to register for my shot. They'll ask you the pertinent questions. They write nothing down. They just put it in your form, hit submit, and they'll confirm for you that what your date and time was that you chose, because you get to choose your time, date and time. And those folks just have to hold on to that and show up when they're scheduled.
All right, Mr.
And then we'll
Lanphere,
follow up in the future.
Over at Cambridge Health, sound familiar? Is that how you're sort of doing it as well?
Yeah, we're still in phase 1, so we are wrapping up our workforce vaccination efforts, and we have begun the process of vaccinating in congregate care settings, particularly in all of the communities, including, I believe Malden is in the community that we're also been reaching out to the Council on Aging to help vaccinate those groups. And, for us, the average age of the patient currently hospitalized for COVID in Massachusetts right now is 71 years old. So I think it's critical that between the health systems and our public health colleagues, that we truly do try to get the most vulnerable citizens first. Really those with, significant comorbidities, cancer, and the elderly really are the folks that we really need to get to first. And so we've gone a year without a vaccine. A vaccine's here. I think people just need to hold on a little bit longer. We'll get to them, but we really do need to focus our efforts on those groups who I think are most at risk. And for me, it's the elderly at this moment.
All right, very good. Mr. Cochran, back to the studio.
Sure. Again, we're still waiting for questions to come in from you folks out there. Again, we will draw from the questions that we've already had submitted. For those, I think actually was touched on earlier, but I'll go ahead and ask the question for follow-up anyway. So for those that have had COVID already, the reasoning, it sounded like, was not so much from a clinical perspective of not getting the vaccine, but more because you already actually can, have the antibodies. So there's no clinical reason necessarily for the vaccine. Like it's not doubling up of the vaccine or anything of that sort.
No. So again, now we have a new administration, but the CDC guidance had asked us to hold off on vaccinating anyone who had COVID within the previous 3 months because they already have the antibodies. There's no clinical indication that anyone who did have COVID fared better or worse in the clinical trials. It was really more of a public health measure to try to maximize people who have antibodies against those who need them. And that was how the vaccine was going to treat them.
Dr. Nickerson, will the vaccine prevent someone from getting sick again?
So we don't know for sure yet because this is just too early in having the vaccine available, but there are probably a couple different options. One is that if the vaccine is really good and prevents the virus from infecting you, so that means the antibodies can bind it before it can interact with your body's cells and really shut down at that level, then you will never even know you were exposed. But what's more likely is that the virus will infect, your body will immediately recognize it and shut it down. And then you will be, you'll maybe have mild symptoms at most. And that's really what we're hoping for. That's kind of what you see with the flu each year. People can still get the flu, but when they have their flu vaccine, it shuts down the course of illness. They recover much faster and they're less contagious to those around them. So it's kind of a win across the board.
Chris, will does someone only feel the full effects after the first dose, or is it only after the second dose?
You mean a physical effect themselves, or
just that things are improving for them relative to COVID?
I think people should feel confident that after the second dose, that, you know, it's like the science is basically they introduce this virus to you and your body, a variant of the virus, and your body fights it off. If your body reacts both times, that's great. If it doesn't, I wouldn't worry about that either, because what happened is the first time you got the shot, you didn't feel anything. It means you're virus free. Your body's not reacting to anything except what went into it and its synthetic form. Some people will have that reaction because they've already had COVID. It's hard to say what your body's going to react to, or not, for that matter. So my experience, I've had one shot so far, and I only had local pain. That was it, because it is intermuscular. So that's unavoidable.
It was either Dr. Nickerson or Mr. Lanphere. In the past, you, I think, have said on paper or in some of the early trials that after the first shot, you think that gives you 50%, and then the second shot has you in the 90s. Is that still accurate?
In the clinical trial, people have between 50 and 58% coverage. It isn't until you get to that second dose where you get to 95% coverage. And, you know, I think our pharmacy colleagues couldn't stress to me enough just how incredible we've come with technology. That really, in order for us to get a vaccine of this magnitude with this success rate, 95% success rate, is quite huge. And if you think about the flu vaccine, you know, some years it's 40%, some years it's 60%, some years it's better. To have something up front, like, you know, with this high of a success rate it's unremarkable. So I think people should take credit. You know, I sort of credit this to maybe this is the future of the vaccine development process, but also keeping in mind that, you know, given that you get the shot today doesn't mean that you're now covered. Your body still needs 2 weeks after you receive the shot to be fully immunized. So we want people to understand how vaccines work, and that the shot is not something that is automatic immunity immediately after receiving. It's going to take 2 weeks after you receive the second dose for you to really be fully immunized.
All right, Dr. Nickerson, you want to add anything to that?
Nope, that's perfect. Yeah, your immune system takes a minute to actually understand what's going on, more than a minute, 2 weeks worth of time to really be able to capture what it saw and build those memory cells and then be ready to fight it again in the future. And that's why we do a couple doses. It's so you don't know everything from a course that you went to in one study session, but you follow up in a couple weeks and that reinforces that information. That's really the same thing that's happening here when we have both doses of that vaccine.
Okay, Mr. Cochran.
We're going to go back to the schedule. And so, Mr. Webb, you covered how phase 2, you know, that you guys were just about to enter into that. So when phase 3 comes, is phase 3 going to be handled by the public health department, or is that something where then you are told to go to your primary care provider down that avenue, or has that been sorted out yet?
Chris?
That's a great question, Ron. Actually, we had conversations today that tell us that the primary care physicians are next in line to be notified. That process has been defined, and they'll be, through their health networks, be brought up to speed. I think the health department will be vaccinating now until doomsday, if that's what it takes, but we'll have a lot of partners. You know, there'll be other large sites. I think more of the Walgreens walk-in kind of thing will be a reality, or they'll have daily tents outside, whatever works best for them. But I think you'll start seeing it pop up. The only reason we haven't is vaccine availability. That's really what it comes down to.
Okay.
Ron? What about, Ron, let me stop you for a second.
Sure.
Just reminded me though. This question came up to Mr. Cochran and I. Someone experiencing symptoms or who is fighting off COVID-19, should push off their appointment to get the vaccine, correct? Does that still stand?
Yes.
Okay.
Yes,
That's
it does.
not even a
They
point
should
of
be,
contention.
yeah, they should be asymptomatic when they get the shot. And if they've had, a serious case or even, more than mild, they should talk to their physician before they do that. Could be a respiratory issue for them.
Oh, okay. Okay. All right. Ron, do you have another one in the queue?
Yeah, so actually this came in as a follow-up to Chris mentioned about volunteers potentially for this call center, so to speak. If is this something that we are asking the residents to present? If they have experience, are you looking for folks with a past experience in the medical field? I mean, you mentioned the MRC and the CERT team and such. But are you looking for pretty much anybody that can answer the phone? Maybe you could elaborate on that.
Sure. What we're looking for is we're always going to need nurses to give nurses a day off. So we'll always take a volunteer nurse. Our MRC will provide us with some, but not as many as we'd like because, of course, they're working for hospitals and other facilities right now. So that's why we're seeking out retired nurses, retired EMTs, retired doctors, dentists, veterinarians, if they still licensed. And we're going to ask our teens and seniors if they want to work the phone center, helping people register for a vaccination. A very simple process. The phone will ring. You'll ask, hi, how can I help you? They'll tell you they want to register for the vaccination. You just fill in the form for them and submit it. We really would like to get some people with language skills. Obviously, that'll help. The site does have 4 languages in it right now. We're supposed to get more as we go along here. So hopefully that will happen. But we think we're going to get a very good mix. And we're excited about this because we want to be able to get to people who also cannot make it to a clinic. If they're homebound for any reason, they can call that number and their information will be taken. We'll set up an appointment to go to their home and make sure they're vaccinated.
And Chris, tell people, I was there with you on Friday to observe the first clinic for our first responders. Someone coming in to get the shot, on average, what's it take? 3 to 4 minutes?
Yes, we were averaging 3.5 minutes.
Yeah. Okay.
Yeah, we're going to use 3 minutes in all our build outs from now on.
Okay. All right. Let's see. While Ron's looking for the next question, I have a question for all 3 of you. Where is the flu? This was supposed to be one of the seasons, but is it me, or have you not heard anything, or is that an effect of the masks and everything else that's going on?
I think that's exactly it. We actually were very careful observing what was happening in the Southern Hemisphere during the summer months to watch how the flu was behaving this year. And I think with better hand washing, masking, Purelling, I think the Southern Hemisphere saw a lighter flu season. And I think we are also seeing a lighter flu season. So I think that what this helps people understand is just how important just simple tasks such as hand washing, staying home if you're sick really can help minimize, the flu season.
Dr. Nickerson, you agree?
Absolutely. And I think there's something to be learned here too, maybe moving forward, is that if we can respect when you don't feel ill, or when you feel ill, to stay home, or if there are things that you have to do, can you wear a mask for that excursion? And then you're going to really shut down kind of the spread that you will transmit to other people. And then maybe we can make the flu and some of these other contagious illnesses less of a burden for our whole community.
Okay. And Chris, so if this can be attributed to some of the measures that are in place, do you see this maybe being part of our future every year thereafter? I mean, come October, everybody masks up for a couple of months, or?
I don't think, you'll have, I think it might be part of the recommendation that we build in. Absolutely. I think, we watch a lot of our Asian residents at various times of the year, and you'll see folks wearing a mask and everybody assumes it's because of the bus fumes. It's not. Someone in their family or someone they know is ill, so they're taking the chance of, I might be sick, I'm not spreading it on. It's something we probably have hopefully come to adopt. And if not, it's if you ever have a sniffle or a cough and you're going running down the store, you throw a mask on, other people will understand it's not it's a courtesy but extended by you, hopefully. And, build community around it. There's nothing wrong with that happening if it does indeed happen. That's what I hope to see.
Okay. And I don't want to jinx it, but generally speaking, are we coming out of flu season? Are we still in the middle of it? Dr. Nickerson, where would we be in a normal year right now?
I think we're still in it, but I'll check with Chris.
Okay, Chris, we're still...
Yeah, we're still right at the peak of it, yes.
Okay.
And the numbers are encouraging, very encouraging.
Yep. All right, back up top to Mr. Cochran.
I'll second that sentiment earlier about having something become a new norm, because that sounds like a great idea going forward. It just seems like it would make sense. And along those lines, throughout all these COVID shows, I really haven't had much of my own expertise to offer because it's not my purview. But what I can say is I know about social media. It's what I do in my job. And I will say one recommendation I have to the public is when you do get vaccinated, take a selfie and show the world that you were vaccinated, because there is social acceptance to these things. So when you see your friends getting vaccinated, for those that have questions, those that might be sitting on the fence, those that might have any reservations at all, you see 4, 5, 10, 20 of your friends getting vaccinated, you're much more likely to do that. So do that service, get vaccinated, and take a selfie, whatever hashtag you want. I'll let you decide that.
We encourage it at the clinics, actually. So we will give you time to do it.
Except for me, Ron. They may not want to look at my...
Well, you did. You constantly remind me about this, and I will show you. Actually, we won't show that image because it may have the opposite effect. But
right.
The wincing of the mayor was all an act. Okay, so he really didn't.
Yeah, don't remind me. All right, let's go back to the questions. What do you have next?
Sure thing. So going back to there was a question on the variant we'll dive into. So far we've heard that the variant will likely be covered by the vaccine. The variant will presents potentially more virality, right? More contagious than the current strain. But we haven't, and then we've also talked about the possibility of getting reinfected. I don't think I heard an all the way answer on that. So if somebody has had COVID, the variant, does it affect them as if it's a brand new virus, like it's a completely, different version of COVID-19 that the person does not have antibodies again? Or maybe you could go into that.
Dr. Nickerson, do they start over?
So it depends on the variant. So the variants that we're seeing now, we're not seeing a difference in their clinical presentation. As Christian was saying before, we're seeing a difference in spread, that we think it's more easily transmitted from individual to individual. But this is one variant, and we know that as we are a little bit more lax on our mask wearing and we allow the virus to spread more, there can be opportunities for new variants to arise. And that is what time will tell about how our current vaccines work and protect us, and how reinfection could happen as well. So we're still all learning a lot at this point. And for what we know now and what is out there right now, knock on wood, our vaccines are doing a great job, and they're going to keep that at bay.
And I know I talked to Mr. Webb, Christian, about this. This variant is not fatal, correct? Well, it could be fatal, but it's not what it could be when you get a variant, right?
Yeah. I think what's important here for people to fully understand is that the healthcare system is stressed. And because this variant is not more deadly, and in fact, this second time around, I think this is important for people to know, that we have seen more patients admitted to the hospital for non-COVID or COVID-related reasons that are going to med-surg units. They're not going to intensive care. But where we're going to get ourselves into trouble is if we get too many people who don't adhere to the public health guidelines that have already been well established for this, and our systems become so overstretched that we can't adequately care for people, as we're already sort of seeing in California. And this is not to scare people, but the system is stressed already. And if we continue to see more and more people come into a system that's already stressed, then the care can become compromised, because there's only so many medical providers available and so many beds available. And we have more people. So I do implore that people continue to, follow the public health guidelines, social distancing, the masking. We will get there with the vaccine. We just need a little bit more time. And the stakes are now upped a bit because the variant is here, and it's in the surrounding states as well. So we need to continue to do what we're doing to really reduce the risk that we're going to see a large increase in hospital admissions, because the system is just so stressed across the state.
Chris, anything you want to add? I know
it can't be any more important that we lower the hospital rate. You and I had a conversation last week about hospital rate, and that is the number one driver that people should keep in mind. The more people that stay out of the hospital, the better off everybody is, for the obvious reasons. We've all been touched by it. Do what you got to do. It's like we're hoping. It just should be part of your everyday life from now on. Just look at it that way, and you'll be better for it.
Hey, Chris, even with the variant, though, let's talk about last night. So on the heels of the town hall forum relative to welcoming the next segment of students back to school, you're still not seeing the transmission at the younger level, right? I mean, we've had kids in school now for 3 months, and you're still not seeing it.
No, not at any concernable rate. Typical holiday period stuff that we really couldn't attribute to anything else. So no, and that's a credit to our teachers. That's a credit to the principals at the schools who are really doing the yeoman's work, monitoring all these things. And the staff's been great taking on the changes. So the kids seem to be doing well with it too. So that's good to hear.
Okay, Ron.
Okay, we do have our first caller of the evening. We're going to have Joan. Joan, go ahead. You are on the air with the panel.
Thank you all for being there again tonight. My question is for Dr. Kourtney. As a compromised senior who didn't get a chance to get the flu shot at all, will the COVID vaccine help with against the flu?
Good question.
Hi, Joan. Thanks for calling in. That's a great question. It is not too late to get your flu shot. As you know, we're still in the middle of flu season. So if that is an option for you and your doctor recommends it, go for it. Go get your flu shot, because the flu shot will not protect you against COVID-19. They're two different viruses that your body needs the different vaccines in order to protect you against them. So I would reach out to your doctor, see if they're willing to recommend getting you the flu shot, and figure out a way to make that happen.
Thank you, Joan. All right, Ron, back to you.
We're going to be following up, just trying to check all those channels. Again, just a reminder, folks, if you do want to ask us a question, you can go ahead and ask us through Facebook, or you can call in live to the studio at UMA, and that's 781-388-9394. We're broadcasting live currently on Comcast Channel 22 and Verizon 26, and on UMA's YouTube channel, which we're monitoring all of those channels for questions. We also want to remind folks too, Mr. Mayor, you made reference to the forum that we conducted last night. Malden Access Television, UMA, will be rebroadcasting that forum. So for those folks that did not get a chance to watch live, which, by the way, just want to remind folks, the passion behind this was immense. 600 people from our public school families listened in on that webinar last night. And I believe, Mr. Mayor, there were almost 400 questions queued up. We spent about an hour and a half. So that's all going to be rebroadcast. So for you Malden public school families that want to watch that, UMA will be broadcasting that. And also, I believe Superintendent O'Terry will be sending out a link to the rebroadcast of that.
He did that this evening.
Okay, great. All right, we do have another caller with us. Kevin, go ahead. You are on the air with the panel.
Good evening, Mayor. Good evening, panel.
Hey, Kevin.
Once again, thank you for having this open forum to answer questions. You know, once again, I think the knowledge you give us is better than our imagination. My concern, and I know for you, Mayor, it's me beating a dead horse, is that we see the numbers have spiked. We see everything that's going on. In the past, you said it was really impossible to enforce mask wearing. But, you know, we don't have officers at every stop sign, but we still write tickets for running stop signs. At some point, is it going to have to get to the point that it's mandated? The reason I ask this, I have a dash cam. We happen to be looking at the footage. I only went to AutoZone, which is about a 3-minute drive. In the course of doing this, just people in public, we spotted almost 13 people in that short drive from AutoZone back to my home that either had the mask around their chin or no mask at all. So, you know, with the variants, with the, you know, increases, with the thought of maybe nationally we'd be mandated to wear, you know, masks at all times, there's no possibility of this being an enforceable rule.
Yeah, I still don't. I mean, Chris, I don't know if you want to lead off. I can wrap in. I mean, you're out there enforcing it now and it's hard, right?
Yeah, I mean, you know, you confront someone, they pull something out of their pocket. Everybody's got their, you know, reason for not doing it. A lot of people blow one out and they don't have another one with them. Things like that. There are reasons. I don't want to make excuses because there's ultimately people who aren't going to do it. That would like to give them a fine, but that's not going to educate them. And that's really what we're trying to do. There's just some folks we can't reach. I've had a few instances myself, you know, nothing crazy, but they're just not going to do it. So like we've told everybody from day one, worry about yourself, take the precautions that protect you as an individual. That way you're not transmitting to anybody else and you're not receiving anything. So really focus on that. When you see these people without masks, just keep your you know, distance. Make sure your mask is properly on and keep going. If you feel strongly about it, let the police know. Some people have put things in on See, Click, Fix. That is not real time. So if you're really concerned for somebody, please call the police department. They will look into it.
All right, Doctor and Christian, do you want to add? Let's start with you, Doctor. Anything you want to add to that?
Yeah, I do want to add that it breaks my heart that we don't have more options for enforcing the mask mandate, and it is it's a personal responsibility, and we should take pride in the fact that we show that we care about each other when we choose to wear a mask, and we should really push each other to be better and to know that that's our best strategy to really start shutting down any spread from you know, in the community.
Yeah.
So
Yeah. All right, and Christian?
Well, I would say, I would ask people to join in on President Biden's call to wear a mask for 100 days. I think if we can get people through for the next 100 days, well, that gives both healthcare and public health and the state professionals the opportunity, the chance to vaccinate a ton more people. I think then we can probably, hopefully, feel like things are going to start returning to normal a little bit faster. But we need everyone's help to do this. And so the 100 days challenge, really, we should be starting that now.
Yeah, and Kevin, any event we go to, we usually bring a bag of masks with us. So we're also trying to get at them that way. We'll stop people individually in the street, or if there's an organized event, we typically travel now with a stack of masks. So, all right, thank you, Kevin. Back to Mr. Cochran.
Sure. So actually, next question, we'll go right back to, it was mentioned about President Biden's 100-day mask wearing initiative. What else, this is for the panel, what else do you expect from the Biden administration that will be different, going forward? And let's bring it down to Malden. We can all obviously talk politically and go on all night about some of the more controversial subjects, but let's roll it down specifically into Malden. How do Biden initiatives work their way down to the city of Malden?
Okay, Mr. Webb.
I think what you're going to see is a real federal response. And I know that the federal government has a pandemic plan. I think it's probably been modified for what we're dealing with. But you see, National Guard will be activated. I think you'll see military bases activated so that people will be able to go on and off and be vaccinated there. Hospitals will get some more support from different agencies within the federal government, so they'll be able to vaccinate more. And it'll kind of trickle down. Doctors' offices will get a steady supply. The key is a steady supply. Any break in that chain erodes confidence, and that's the last thing you want when you're doing something like this. So I think that the president-elect will focus there, hopefully.
He's not elected.
Okay. Christian, anything you want to add?
I think Chris is right. I think the challenge that we've had is that there's been no federal coordination. I saw it with H1N1. We saw it with Ebola. Some of these other major infectious disease events that have, sort of hit this country. There was a national and federal response that all of us were operating off of one common picture. And I think this past year, states have sort of been sort of managing this themselves. So people are doing things differently. I think the vaccine in itself, Massachusetts has handled it one way, other states are handling it different ways. I think if we're all operating off of one common picture moving forward, I think this will be a much more coordinated and organized problem to be addressed moving forward.
Okay, Doctor.
I'll add into the leadership. I think we will see some leadership and some guidelines there. And it was important to note that at the start of the pandemic, we had our New England states really come together and come up with a plan. And you saw things, worked out for quite some time. We kept that spread down until the end of June, and then it's been slowly creeping up since. We also, I'd love to see some coordinated guidelines on testing, because right now you can travel state to state and there's recommended quarantines, but we have no enforcement because it's not possible to enforce that. We're really relying on people's honor to say, I'm home because I traveled and I need to wait this out and make sure that I'm not contagious and going to spread this to others. So I'm hoping that with some good leadership and some consistency, again, with guidelines and a better understanding, a communication of what is science and fact, that will help everybody understand why we take these precautions, why we test at certain times, because it's a snapshot of whether or not you were exposed and are contagious. And then that information now is not fake truths or whatever. It's backed up by knowledge and people that are experts that understand this, and it's guidelines for us all to follow.
All right, Ron, we just got a couple more minutes. So did we get through all the questions?
Actually, what we can do here is wrap up with a final caller that we have on the line. So let's do that, and then we can close it out from there. So we're going to go to Chrissy. Chrissy, go ahead. You are on the air with the panel.
Good evening, Chrissy.
Hi, yes. Where can you get vaccinated at? Where will they be available at?
Okay, so Chris, where do you think these clinics will end up being? I think you're on mute, Chris.
They will be at the Salem Wood School in the field house. They'll be every Tuesday, every Thursday, starting January 4th. We'll move through the phases.
February 4th.
I'm sorry, I keep doing that. February 1st. Not like I don't want to get far away from 2020, but
February 4th, right?
February 4th, those clinics will start. That's a Thursday. And then every Tuesday, every Thursday, the first Saturday and third Saturday of the month, we'll have clinics at that location.
All right, Chrissy, and I think that was chosen because it's somewhat centrally located.
Good
It's
bus
on the
lines.
bike path. Yep, good bus lines, et cetera. So, Chrissy, just hang in there. We'll be notifying people when they're up. All right. So, Ron, you want to help us close out then?
Yeah, sure. We just we want to remind folks that if you did not get a chance to get your question asked tonight, we'll always take those offline And we can either ask it at the next show or we can forward it to the panel. And we like to thank all our guests for joining us. So we'll kick it off to you guests to close out with some closing remarks.
All right, Christian.
Well, Mr. Mayor, and I want to thank you, Chris and Kourtney and Ron. I've gotten to call you guys, I feel like I call you guys my colleagues now. It's important that I think we continue to, move in the direction we're moving. We're getting to a better place. The vaccines are a exciting new important dynamic that's been added to our arsenal. It's important, though, that depending on whether it's Moderna or Pfizer, that when you go back for that second dose, your provider make sure that you get the same, that you get vaccinated for the second dose with the same provider. And also, it's important for particularly people who have other comorbidities or even pregnant to have a conversation with their medical provider and really have a shared decision about whether it's safe for you to get the vaccine now or to wait till later. And also, I would leave you with this, that there are groups first that are being prioritized, and we would just be asking that the public gives us an opportunity to vaccinate those priority groups first, and then we will get to everybody as we start moving forward and vaccine starts becoming much more widely available.
All right, very good. And how do people get a hold of you, Christian, if they want to call you?
Call the Cambridge Health Alliance at 617-665-1000.
All right, very good. Over to you, Dr. Nickerson.
Well, thank you again, Mayor and Chris and Christian and Ron and the staff at UMA for having us again tonight. It's always great to hear your questions and be able to communicate some of this information to the public. I know it's a little bit scary still. We are coming up on a year of this. Our tools haven't changed. Please continue to wear your masks, wash your hands, social distance, be thoughtful in your excursions when you go out. Try to consolidate it to a single trip to the store every couple weeks. Order your takeout and support our local businesses because everybody is struggling right now. And remember that our hospitals are stressed. Our healthcare workers are going through a very, very hard time. They are seeing more tough things than we could ever even imagine. So to extend kindness to all of our neighbors and those around us. And take care. Have a good night.
All right, thank you. And Mr. Webb? You're on mute, Chris. Yep.
I want to ask people to watch out for one another as well. This registration process coming up is very important. It is going to speed up the process remarkably. We did one clinic and know that to be true. It was the most amazing thing I'd ever seen. So I would ask folks to, if you have a neighbor or friend, when it's your time to register, please help anybody you can register. Okay, it's like picking out an appointment to get your hair cut. It's that simple. So, do that for as many people as you can, so we get as many people registered and vaccinated as possible. We will be putting together what we hope to be a very strong phone tree, so that you'll be able to call in and we'll be able to service you. We're looking forward to pulling that little technical miracle off, but we can do it. We know we can, and with their help, that will happen. And if this is going to be a marathon. This is not a sprint. I need people to understand that, and to understand that because the phase that you see on the website say February doesn't mean February 1, because we're beholden to many things. The vaccine gets interrupted by weather, tsunami, just manufacturing issues. There are going to be times when clinics are canceled and you may get moved off. Be patient. Keep your eye out. Look on the state website at mass.gov/vaccine, and it says where there's a tab that says where can I get my vaccine. Click on that. Check it often, and you'll see new sites opening up and closing and doing what they've got to do. But you can go to any of them. So don't limit yourself. Make a day trip of it. Get vaccinated, get an ice cream, and go home. But try and use that site as best you can. Be flexible, be patient. Every clinic's going to be a little different, but that's going to be our new reality for a little bit of time is how do I get it? How much time can I put into it? How long will it take? As we do more, we're going to get better. So bear with us. It's all new to us too. We've never vaccinated what we think is going to be almost 6.5 million people in this state alone.
And Chris, one more time, people that want to reach you.
That can be reached at my office number is 781-397-7049. And my email is cwebb@cityofmalden.org.
All right, very good. And just this week, we recognized and celebrated the life of Dr. Martin Luther King Jr. And one of my favorite quotes of his was, "Everyone can be great because everybody can serve." And we have seen that over the past year, from the Warming Center to Helping Bread of Life, to Malden Neighbors Helping Neighbors, and to what our panelists said about last night's town hall on the return to school. 600 people tuned in. This is what it takes, and you have shown that. And on behalf of the panelists and Mr. Cochran and everybody at UMA, we just want to say thank you for staying with us and continuing to help us get to where we all want to go. So good evening, everyone. Stay safe, and we'll be back to see you again shortly.